Okay, Vernon Watkins is a 69-year-old male. He is full cold and allergic to penicillin. He arrived at the ED 4 days ago on May 17th with complaints of nausea, vomiting, and severe abdominal pain. He was admitted to the surgical team today, May 21st, for emergent surgery for bowel perforation. Diagnosis of post-op hemicolectomy. History of high blood pressure, and he currently takes medication for this. He has smoked a half pack of cigarettes each day for the past 50 years. Pain in his right leg that always hurts is described as soreness and worsens with movement. He also has chest pain and it hurts to breathe. He rated his pain a 3 out of 10. He also complained of feeling fatigued. I did not administer morphine from the orders due to his episode of respiratory distress. His pain level is now at a 1 out of 10. Current vital signs are blood pressure of 154/92, temperature 99, heart rate 108, pulse 115, strong and regular, SpO2 94% via non-rebreather mask on 15 liters per minute. He is alert and oriented ×4. I administered a bolus of 6,400 IU of heparin, then titrated the heparin in dextrose 5% in water at 1,440 units per hour. I held morphine medication for abdominal pain. Respiratory, his lung sounds are clear. He experienced much difficulty breathing. Currently on oxygen therapy via the non-rebreather mask. I positioned a patient sitting up to help with breathing. Cardiac, he has a 3-lead ECG monitoring that shows patient is sinus tachycardic with signs of pulmonary hypertension. Heart sounds are normal. I obtained a 12-lead ECG. He has normal eye movements. Pupils are equal and reactive. He has normal skin turgor. Skin is cool and very sweaty. He has a midline abdominal incision with dressing that is dry and intact. He has not eaten today. He's currently on a soft diet. There's bowel sounds that are normal in all 4 quadrants. His last bowel movement was yesterday. His last urine output was 400 milliliters at 6 a.m. His IV site had no redness or swelling, and it is patent. Patient refused to ambulate related to the pain in his right leg, but now that pain level has decreased, you should assist the patient with activity when ordered. Abnormal lab test, he had a D-dimer of 0.9. His arterial blood gas showed a pH of 7.49, HCO3 of 21, PCO2 26, PO2 of 71, and SaO2 of 93. He had a chest x-ray that showed no signs of pneumothorax, and then he also had a spiral CT scan. The provider was called due to the pulmonary embolism, and this is what was confirmed. I recommend continuing to monitor his pulmonary embolism and watch that the soreness and swelling in his right leg decreases. Monitor his medication of heparin and watch for any signs of bleeding. Keep his SpO2 above 92% and prepare to take him off oxygen therapy when appropriate. Monitor his respirations and heart rate and watch his lab results for any abnormal values. And lastly, continue ECG monitoring and assess surgical dressing for drainage or infection. Administer the morphine when appropriate for his abdominal pain if needed.